Right, so we want to quickly look at the pharmacology of another general class of drugs. This is what is known as what? The beta-adrenergic types of drugs. Alright, beta-adrenergic types of drugs. Yeah. So, for the beta-adrenergic agonist, beta-adrenergic agonist, we look at the pharmacology, we look at the examples. Then after we're done here, we'll now start looking at each of the drug. You understand pharmacology of each of the drug. So we say that it's commonly known as beta blockers. Right? They're actually a class of medication that what reduce the effects of what adrenaline and noradrenaline on the cardiovascular system. Right? So for mechanism of action is they actually work by blocking the beta-adrenergic receptors in the heart. Okay, so they block the beta-adrenergic receptors in the heart and blood vessels. So the whole action will be what will now reduce heart rate, decrease force of heart contractions, dilate blood vessels, even lower down the blood pressure, and reduce the workload on the heart. Right? So what's the use of beta blockers? You might want to use it to treat a lot of conditions like what? Hypertension, angina, heart failure, arrhythmias, irregular heartbeats, myocardial infarction, right? Migraine prevention, right? Some certain types of anxieties, you understand? So basically, you want to now what? Reduce the effect of noradrenaline and adrenaline on the heart. Okay. So for types, you see metoprolol, right? So have the non-selective ones like the propranolol, nadolol. We have the selective one like the atenolol, bisoprolol, metoprolol. We have the beta blockers with intrinsic what? Sympathomimetic activity, pindolol, acebutolol, and all of that. So side effects of these drugs include they can cause fatigue, weakness, cold hands and feet, weight gain and depression. Right? So some patients may also experience what? Slow heart rate, that's bradycardia, low blood pressure, that's hypotension. There's sometimes can cause like all those bronchospasms, right? So precautions, they should be using with caution in patients with asthma or other respiratory conditions. Right? So even if the patient has diabetes or some certain heart conditions, alright, you use this with care. Alright. So I think basically that was it. Alright. Basically slow down activities in the heart. So when we look at them one by one, you get to understand the whole concept better.